So, welcome back to CHT PREP 2024 practice questions. This is the February edition. I added some red font for Valentine's Day, so hopefully you guys like that and it makes it a little bit more fun. So, here is how it is going to work today. I am going to go through each of the questions. There's 15 questions that are following, so grab your pen, your paper, your iPad, your computer, whatever you want. But make sure you have a way to write down your answers, commit to them. They are multiple choice questions today, so feel free to pause the video if you need time to think, and then we will go through all of the questions, and then we will take a little pause. You can pause the video if you need to or go back, and then we'll go through all of the answers, and that's how we are going to do it today. So let's get into it. Question 1. Bouchard's nodes are calcific spurs at the A. DIP joint, B. PIP joint, C. MCP joint, D. Thumb MCP joint. Question 2. A patient presents to your clinic with a PIP joint flexion contracture of 30 degrees. Upon assessment, you find that the DIP joint is passively flexible with the PIP joint held in maximum extension. The patient reports that their injury occurred 2 weeks ago, in which the PIP joint was hyperextended forcefully while playing volleyball. What would be the appropriate first step of treatment for this patient? A. Initiate dynamic or serial static splinting to achieve full PIP passive extension, then continuous PIP immobilization in full extension for 6 weeks. B. Initiate active and passive exercises to the PIP and DIP joints. C. Initiate continuous PIP immobilization for 6 weeks. D. Initiate dynamic or serial static splinting to achieve full PIP extension, then continuous PIP immobilization in full extension for 3 weeks. Question 3. Interruption of the central slip of the extensor tendon will cause what finger deformity? A. Mallet finger. B. Boutonniere deformity. C. Pseudo-boutonniere deformity. D. Swan neck deformity. Question 4. You want to assess for bicipital tendinitis. To assess for this, you would use the following test. A. Speeds test. B. Kennedy-Hawkins test. C. Ruse test. D. Empty can test. Question 5. All of the following are common sites of compression or entrapment of the median nerve except A. Arcade of Struthers, B. Arch of flexor digitorum superficialis, C. Pronator teres between the two heads, D. Carpal tunnel, E. Lacertus fibrosis. Question 6. You are treating a patient with a granular, non-draining wound. Which of the following would be an appropriate dressing choice to promote wound healing? A. Impregnated gauze or non-adherent contact layer. B. Alginate. C. Hydrogel. D. Semi-permeable foam. Question 7. Evaluation of a patient with shoulder pain reveals pain and weakness with resisted abduction and external rotation. They also have a positive external lag sign. Which of the following rotator cuff muscles is most likely affected? A. Teres minor. B. Infraspinatus. C. Supraspinatus. D. Subscapularis. Question 8. Which of the following movement combinations create varus stress at the elbow and should be avoided during early range of motion in postoperative rehabilitation of posterolateral rotary instability? A. Shoulder abduction and external rotation. B. Shoulder adduction and internal rotation. C. Shoulder abduction and internal rotation. D. Shoulder adduction and external rotation. Question 9. Which of the following is true regarding treatment of distal radius fractures? A. Range of motion exercises to the wrist can begin 1 to 2 weeks postoperatively after open reduction internal fixation. B. Joint mobilizations can be initiated in non-operative cases at 4 weeks. C. Range of motion to the wrist can begin 1 to 2 weeks postoperatively after external fixation. D. Scar management should be initiated 4 weeks postoperatively after ORIF. Question 10. A 17-year-old male presents to the clinic after a fall on an outstretched hand while practicing at the skate park 1 week ago. The patient went to the emergency room and initial x-rays were negative. Upon examination, he has pain with all wrist motion, tenderness in the snuff box, and swelling about the affected extremity. Which of the following would be the most appropriate immediate treatment plan? A. The therapist should initiate RICE protocol to assist in edema and pain management. B. The therapist should begin digital range of motion and wrist range of motion with intolerance. C. The therapist should place the patient in a forearm-based thumb spica orthosis and refer the patient to the physician for additional imaging. D. The therapist should place the patient in a wrist cock-up splint and initiate digital range of motion exercises. Question 11. A fracture at the metacarpal neck of the 5th digit is known as A. Seymour's fracture, B. Tuft fracture, C. Boxer's fracture, D. Bennett's fracture. Question 12. Which of the following best describes the orientation of the tendons through the carpal tunnel? A. FDS to the index and small fingers lie volar to the FDS to the ring and middle fingers. B. FDP to the long and ring fingers lie volar to the FDP to the index and small fingers. C. FDS to the index and small fingers lie dorsal to the FDS to the ring and middle fingers. D. FDP to the index and small fingers lie dorsal to the FDS to the ring and middle fingers. Question 13. Which of the annular pulleys is considered most important? A. A1 and A3. B. A2 and A3. C. A4 and A1. D. A4 and A2. Question 14. Which active range of motion exercise would best achieve maximum FDS glide? A. Straight fist. B. Composite fist. C. Hook fist. D. Tabletop intrinsic plus position. Question 15. What orthosis positioning is recommended in minimal active muscle tendon tension MAMTT protocol in flexor tendon rehabilitation? A. Dorsal blocking orthosis with wrist neutral to slight extension, MCP joints in 45 degrees flexion, and IP joints fully extended. B. Dorsal blocking orthosis with wrist 30 to 40 degrees of flexion, MCP joints in 45 degrees flexion, IP joints fully extended with elastic traction attached to a proximal forearm strap. C. Dorsal blocking orthosis with wrist 20 degrees extension, MCP joints 45 degrees flexion, IP joints fully extended with elastic traction attached to a proximal forearm strap. D. Dorsal blocking orthosis with wrist 30 to 40 degrees flexion, MCP joints and IP joints in full extension. Congratulations, guys. You made it through all 15 questions. Now it is time to pause the video. Make sure that you have all of your answers ready because we are going to go through the answer to every question. So let's get into it. Question 1, the answer is B, the PIP joint. Question 2, the answer is A, initiate dynamic or serial static splinting to achieve that full passive PIP extension and then continuous PIP immobilization in full extension for 6 weeks. Question 3, the answer is B, boutonniere deformity. Question 4, the answer is A, Speed's test. Question 5, the answer is A, arcade of Struthers. Question 6, the answer is A, impregnated gauze or a non-adherent contact layer. Question 7, the answer is B, infraspinatus. Question 8, the answer is C, shoulder abduction and internal rotation. Question 9, the answer is A, range of motion exercises to the wrist 1 to 2 weeks postoperatively after ORIF. Question 10, the answer is C, the therapist should place the patient in a forearm-based thumb spica and refer the patient to the physician for additional imaging. Question 11, the answer is C, boxer's fracture. Question 12, the answer is C, FDS to the index and small fingers lie dorsal to the FDS to the ring and middle fingers. Question 13, the answer is D, A4 and A2 pulleys. Question 14, the answer is A, straight fist. And finally, question 15, the answer is B, a dorsal blocking orthosis with the wrist 30 to 40 degrees of flexion, MCP joints in 45 degrees flexion, the IP joints fully extended with elastic traction attached to a proximal forearm strap. And that is a wrap on today's video. Congratulations, you guys. You did it. Thank you so much for watching. I hope this video was helpful for you, and looking forward to sharing more CHT prep practice questions every month throughout the year. Let me know what you guys think of the current format. If you want to see anything different, or if you have an idea of how this could be better presented, let me know in the comments below. And if you have a moment to subscribe, I appreciate you so much. Thank you so much for watching, and I'll see you in the next one. Bye.